Hi there, my name is Lucy Grutters, and this is my final presentation for Global Health 101. I titled it Closing the Loop. So for my county, I decided to do Fremont County, which is located in Canyon City, Colorado. The top 3 health priorities from their public health improvement plan were behavioral health, tobacco, and chronic disease. With behavioral health, they focused on mental health and substance abuse. With tobacco, the focus was smoking cessation, youth prevention related to tobacco, and chronic disease focused on obesity, diabetes, cancer, COPD, and heart disease. And many of these chronic diseases are also leading causes of death that we've gone over in Global Health 101. Something that I found interesting was that out of the needs for Colorado inmates, 77% total are related to mental health and mental illnesses, and this is a top priority for the Colorado DOC. This is important because there are over 11 prisons in Fremont County. Colorado's winnable battles included mental health and substance abuse, oral health, food safety, tobacco, obesity, unintended pregnancy, which would be family planning, healthier air, clean water, infectious disease prevention, and injury prevention. So with this emerging and trending health issues, Colorado has experienced a decline in child immunizations as well, driven by the pandemic. And relating back to the local issues, mental health and substance abuse are seen again, tobacco and obesity are mentioned as well. So Colorado's 2024 public health priorities were related to COVID response, climate action and air quality, trending and emerging issues, racism as a public health crisis, behavioral and mental health, transforming Colorado's governmental health system. So those 6 things there, out of those 6, we see behavioral and mental health come up again, as mentioned in the local problem, and trending and emerging issues could really relate to any of the mentioned local health priorities, and so that is a correlation with that. Moving on to Healthy People 2030. Healthy People 2030 is an organization that identifies public health priorities to help individuals, communities across the United States improve their health and well-being. So I won't read all of these, but some of them were related to the chronic diseases in correlation regarding the lifestyles of all ages, from infants all the way up to older adults. And so with this, we see adults meeting current minimum guidelines for aerobic and muscle strengthening activity, adults receiving screenings for colorectal cancer, and then hypertension being under control. And so all of those relate to either obesity, diabetes, cancer, or heart disease. We also see the cigarette smoking in adults being of concern, relating back to the tobacco, and that is also identified within the children and adolescents. For behavioral health, we see children with major depressive episodes who receive treatment being a leading health indicator from Healthy People 2030, and drug overdose and deaths relates back to behavioral health in regards to substance abuse. Health conditions from Healthy People 2030 were addiction, cancer, diabetes, overweight and obesity, mental health and mental disorders, heart disease, and stroke. And so most of those really do relate to behavioral health or chronic disease. Healthy behaviors of Healthy People 2030 relating back to the local issues, which were behavioral health, tobacco use, and chronic disease, were physical activity, preventative care, tobacco use, vaccination, drug and alcohol use. So now we're on to social determinants of health. Social determinants are a part of a person's life. They can impact health. So examples of these would be where people work, where they live, where they're born, where they grow up, and their age. Social determinants of health from the Healthy People 2030 were economic stability, education access and quality, healthcare access and quality, neighborhood and built environment, social and community context. And so with these, healthcare access and quality was a big one relating to the local issues. Here we see behavioral health tying in a ton because with mental health, we have to have access to healthcare services regarding substance abuse and therapies. It also relates to chronic diseases because if you cannot screen for many of these early, such as diabetes, cancer, heart disease, there's going to be a greater risk for detrimental effects from the disease. And then health, behavioral health also relates again just because healthcare access and quality does bring a reassurance just in having that. And tobacco youth prevention programs can be put in place through public health within local communities. Sustainable development goals. The main one that the local health priorities related to was number 3, which was good health and well-being. Good health and well-being ensures healthy lives and promotes well-being for all ages, and this includes immunization, chronic illnesses, and behavioral health. So a good quote related to the SDGs was from Leanna Wen, and it says, "Public health is a powerful tool to level that playing field, to bend the arc of our country away from the distrust and disparities and back towards equity and justice." And so I just love this because that's exactly what the SDGs do. They're just trying to respond and trying to decrease the disparities between communities that aren't as equipped. So they're trying to definitely promote this quote.